Mr. Chairman. Secretary Sebelius, as you know, for months I've expressed concerns about the privacy and security controls being implemented as part of this federally facilitated marketplace. We know now that key officials in the administration knew that there were privacy and security risks as well as serious operational issues that might occur if the exchanges went live on October 1st. Yet a decision was still made not to delay the launch until those issues were fully addressed. Many people, including myself, have called for an independent entity, such as the Government Accounting Office, for example, to conduct an end-to-end review of the marketplace to ensure adequate privacy and security controls were in place before it went live. So I have a number of questions about why you made the decision to go forward, even when you knew there were serious security risks and operational issues that would likely occur. Number one, when did you find out about the potential security risks to users of the website?
Sir, I would say that the August preliminary report from an independent reviewer, MITRE, identified that there were risks. GAO had identified that there are risks with every system that goes live, and we took those risks very seriously.
Okay, so by August you knew. Who briefed you on the potential security risks if the launch went forward as planned?
Again, Senator,
Did anybody brief you on the security risks?
We discussed security as part of the overall operations on a regular basis with the operations team, but no one, I would say, suggested that the risks outweighed the importance of moving forward, including our independent evaluator, MITRE, who made recommendations to CMS, as is required.
Well, I've been suggesting that since April. You stated that you felt strongly that the launch needed to proceed on October 1st for the millions of Americans who do not have health insurance so they could get coverage as soon as possible. However, how did you balance that need with the risk that those same Americans might then fall victim to identity theft or have their personal information compromised by insufficient privacy and security controls? How did you balance that?
Well, I share your concerns about individual privacy, and I would say the site was developed with the highest standards in mind. It is FSMA certified, which is the federal standard. It meets the NIST standards, and we took very seriously the information in the hub was specifically designed so that the federal government wasn't storing privacy information. It actually accessed other secure government websites, but we tried to store the minimum possible information. We don't collect any personal health information, which is typically done by insurance companies today, so we don't have that at all.
You do collect Social Security numbers?
We don't, sir, we
collect information
don't collect them. The hub is a router function that actually identifies a Social Security number, verifies it with the Social Security Administration, but that information is not kept and stored.
But don't they have to give their family income and other
And that is verified with
data?
the IRS. It's Homeland Security verifies.
But it's also on the hub, is what I'm saying.
But the hub is
these
just a
identity
router.
thieves
It's pinging Homeland Security database, it's pinging IRS database, and it's pinging Social Security database. It is not storing unique information.
Well, what were the trade-offs with launching the exchange on October 1st rather than waiting until a later date? Could other pieces of the marketplace have been delayed rather than launch the marketplace with insufficient privacy and security controls?
Again, Senator, I would say that the standards that have been set out for security controls were met. You mentioned end-to-end testing, and there were features of the system that were loaded very close to launch date, and that is why I think the administrator chose to authorize a temporary authorization to operate and not a permanent, because you can't permanently authorize an authorization until you have the entire system. We knew we had features in the system which we had chosen not to apply from the outset.
Could you tell
The
the-
shopping feature, the Spanish website, again, those need to be tested before the system can be fully authorized.
Could you tell the committee how many people have signed up for health care under the current system?
Senator, we will have enrollment numbers out next week. We are still working on particularly the 834s, which is the enrollment piece with insurers, and we want to make sure we give you valid, accurate numbers.
My time is up, Mr. Chairman.